Good evening, one and all. We are welcoming you all to that online national CME of Smriti Tarankam. Can you introduce Dr. Lakshmi?
Good evening, one and all. Thank you, ma'am. Welcome to Smriti Tarangam 2023, 1 week national CME on pediatric epilepsy, organized by the Department of Kaumarabritya Government Ayurveda College, Trivandrum, on behalf of 8th National Ayurveda Day celebrations. We are happy to welcome you all on this auspicious day, Kerala Piravi, which marks the birth of the state of Kerala in southern India, which is the hub of Ayurveda. Ayurveda Day is celebrated across India as a mark of respect to Lord Dhanvantari, god of Ayurveda, and is celebrated every year on Dhanvantari Jayanti. This year, 8th Ayurveda Day falls on 10th November 2023. Usually, the Ministry of Ayush choose different themes every year for Ayurveda Day. The theme for this year is Ayurveda for One Health with tagline Ayurveda for Everyone on Every Day. Har din har kisi ke liye Ayurveda. In this national CME, we have selected a relevant topic, pediatric emergency, one of the most common neurological disorder in children. A marked increase in the prevalence has been reported for the past decades, and it is the need of the hour to curb the stigma and negative attitudes attached to epilepsy. So, looking into the modern perspective, epilepsy can be kept under control by taking anti-epileptic drugs rather than complete cure, and it may outgrow seizures. There are various etiological factors like age-related factors, epileptogenic factors, and precipitating factors. So hence, the management of pediatric epilepsy through Ayurveda focuses on to control the seizures rather than suppressing the condition by improving the brain function, supporting the cognitive development, and enhancing overall quality of life. Now, let's move on to the inaugural ceremony, starting with a prayer.
नमामि धन्वन्तरिं आदिदेवम् सुरासुरे वन्दितपादपद्मम् लोके जरारुभयमृत्युनाशम् धाधारमीशम् विविधौषधीनाम्.
Now I welcome Dr. Lakshmi M.K., Associate Professor, Department of Kaumarabritya, for delivering the welcome speech. Welcome, ma'am.
Okay, thank you, Lakshmi. Hope I'm audible.
Yes.
A very warm good evening to all. So welcome you all to the national seminar Smriti Tarangam that we are conducting in association with the National Ayurveda Day celebrations at the Government Ayurveda College, Thiruvananthapuram. So the subject itself is on epilepsy, which is actually which has still lot to explore, particularly in the field of Ayurveda as well as in modern science. So we are expecting a lot of discussions and a lot of contributions from all the doctors and the budding doctors in this platform, so that the field of Kaumarapritya will develop in future in a large scale. So I'm not taking a lot of time. So I will, first of all, I welcome Dr. Roshni ma'am, Roshni Anirudhan, who is presiding the inaugural session. So I welcome you, ma'am, to the Smriti Tarangam on behalf of the Department of Kaumarapritya, Government Ayurveda College, Thiruvananthapuram. And now I welcome Dr. J.G. ma'am, who is the principal of Government Ayurveda College, Thiruvananthapuram, who is inaugurating the session. I welcome Dr. J.G. ma'am to the session on behalf of the Department of Kaumarapritya.
Thank you.
Okay, thank you, ma'am. So for the felicitations, actually we have Dr. Asha Sridhar ma'am, who is the superintendent of Government Ayurveda College Hospital for Women and Children, Pujapura, Thiruvananthapuram, where the Department of Kaumarapritya and the Prasuti Tantra is functioning. So I welcome you, Asha Sridhar ma'am, to the inaugural session. So,
thank you, Lakshmi.
And now I welcome. Thank you, ma'am. Now I welcome Dr. Sheila S. ma'am, who is the professor and head of the Department of Swastha Vritta, at the Government Ayurveda College, Thiruvananthapuram, and she's the convener of the Ayurveda Day celebrations at Government Ayurveda College, Thiruvananthapuram, and she's the coordinator of all these functions that we are doing throughout the month. So
Thank
welcome,
you,
ma'am.
Dr. Lakshmi.
Okay, thank you, ma'am. So now I welcome Dr. Seemaja, ma'am, who is the president of the All Kerala Adhyabaka Sanghadana Association, Akhila Kerala Adhyabaka Sanghadana Association, and she is the professor at the Department of Agatha Tantra. So welcome you, Seemaja, ma'am, to the inaugural session of our national seminar.
Thank you.
Now we welcome the student representatives in the meeting. First, the Secretary of the Postgraduate Students Association, Dr. Adina Chandran. Welcome, Dr. Adina, to the function.
Thank
And
you.
now the Secretary of the Postgraduate Diploma Students Association, Dr. Varsha Mohan. I welcome Varsha to the function. And
Thank you.
as the representative of the House Surgeons Association, we have Dr. Nandu Vijay. And welcome Nandu also to the inaugural session of this national webinar. And now I welcome the representative of the Students' Union, Anasuya PJ, who is the chairperson of the College Union. So welcome Anasuya to the function. And I also welcome Dr. Sohini S., who is the associate professor in the department of our department itself, and she's giving the vote of thanks. So welcome Sohini also to the function. And now I also welcome Dr. Reena Kulkarni, who is the professor and also alumni of our own Department of Kaumarabhritya, Government Ayurveda College, Thiruvananthapuram, who is now working as the professor and HOD of the SDM, Bangalore. So I welcome Reena Kulkarni also to the function, who is the speaker of today. And to the end, I welcome all the delegates and all the doctors who are keen on upgrading their knowledge and their skills in the field of Ayurvedic pediatrics, particularly the neurodevelopmental disorders, to our national webinar. And I hope everyone will get the benefit from our national seminar. So we have tried our best to include maximum number of resource persons in this seminar. So welcome you all. So welcome you all to the function. Thank you. Thank you very much. Over to Lakshmi.
Thank you, ma'am. Now I welcome respected Dr. Roshni Aniruddhan, ma'am, Professor and HOD, Department of Ayurveda, Department of Kaumarabhritya, for presidential address. Welcome, ma'am.
Namaste. Very warm good evening to one and all. Feeling so happy and proud to come in front of you with a national CME on this occasion of celebration of National Ayurveda. Working in a tertiary care center, heading a department of Kaumarabhritya, I feel that it's our duty to share the knowledge, what we have with us, and create a platform for further discussions in the field, uplifting our knowledge, sharing it, and finding a new pathway, correcting ourselves, and heading towards a better, refined healthcare system. So, we are here with a very newer topic, that is pediatric epilepsy. We very well know that neurological diseases of children are commonly managed by all the tertiary care centers across the country. And many of the cases like cerebral palsy, autism, and many mental retardation, all will be having this epilepsy or seizure disorder as an association. Or it may come independently as a seizure disorder to us also. Many of these patients will be having anti-epileptics as advised by a pediatric neurologist. What should be our stand while managing these conditions? Whether we can have a collaborative work with the allopathic pediatric neurologist, and what should be our take while prescribing the medicines, what all we should be careful about. So we have tried to include in this seminar the clinical perspective of management of pediatric epilepsy. So with due stress on the Ayurvedic part, but we have also taken care to include the allopathic parallel by a neurologist in that field also, including the EEG demonstration and researchers, clinical researchers in the field. Early from the 2009 itself, we have conducted many clinical researches in the field of pediatric epilepsy. So we'll be showcasing in front of you 6 researches which have been completed in the field of epilepsy and especially in the field of intractable epilepsy. So I hope that this platform will be a knowledge sharing session. I can see many stalwarts of Kamarapatya from all India, Jamnagar, Jaipur, and across the country. And so happy for that you are attending the seminar, and hope this seminar will enrich our knowledge. Thank you. I invite Dr. J.G. Madam, our respected principal, and who is the backbone and energy source of all our functions for the inaugural address, Madam. Please.
Thank you, Dr. Roshni. Am I audible?
Yes, ma'am.
Delegates from all parts of our nation, the crew behind this great event, Department of Kaumara Pratya, headed by Dr. Roshni Anirudhan, and my dear teachers, PGs, and everyone, a great evening ahead. Welcome to the free online platform of knowledge sharing and learning, Smriti Taranga, in connection with the National Ayurveda Day celebrations 2023. Government Ayurveda College Thiruvananthapuram is the oldest and renowned institution in Ayurvedic medical education sector established by the royal family of Travancore in Kerala back from 134 years. Our Kaumari Mritya department is having a good inflow of patients at children with a number of ailments. Pediatric neurology is a challenging field in pediatrics. Our Kaumari Mritya department has done about 6, Roshni and mentioned earlier, 6 clinical research in intractable epilepsy, co-guided by a clinical pediatric neurologist from the allopathy side, highlighting the scope of Ayurveda in emerging epileptic encephalopathy. I appreciate Kaumari Mritya department for this venture. Good luck. With a few words, I once again congratulate the crew behind and my students and teachers and the crowd behind me, on me, the crowd who are waiting, eagerly waiting for the sessions to begin and declare the program inaugurated. Thank you all. Thank you very much. Thank you, Roshni. Thank you, Lakshmi.
Thank you,
Please
ma'am.
go on.
Thank you, ma'am. And we are blessed to work in an institute where we have a facility of a separate campus for these women and children hospital. So it's a campus where the 2 streams of medicine, that's allopathy and Ayurveda, is working hand in hand. The superint is from the Ayurveda stream and the RMO is from the allopathy stream. And the beauty is that coordinated working of the doctors, both in pediatrics and gynecology. So we are happy to welcome our dear superint, Dr. Asha Sridhar Madam, head of the Department of Prasuti Tantra Sri Roga, the superint of our WNC Hospital of Government Ayurveda College, Trivandrum, to bless us during this occasion. Please, ma'am.
Thank you, Dr. Roshni. Warm good evening, one and all. We know that the whole world is celebrating Ayurveda Day, which falls on November 10th of this year. And so many celebrations are going on, like seminars, conferences, exhibitions, etc. And it is in this scenario, the Department of Kaumara Bhritya came forward with this 1-week seminar, the Smriti Tarangam. this 1 week conference on this epileptic care. Actually, this conference was initiated by Dr. Roshni Anirudhan. You all know, ever vibrant personality, doing so many things in this pediatric care. I congratulate Dr. Roshni for this attempt. Actually, this was conducted at short notice. And I also congratulate all the faculties of Department of Kaumara Bhratya for this initiative. And I wish this conference a grand success. That's all. Thank you.
Thank you, ma'am. Now, I welcome Dr. Sheila S. Madam, Head of the Department of Swastavrta, and also she is the convener of the National Ayurveda Day celebration in our college. A very vibrant personality, and I'm so happy to welcome Dr. Sheila Madam to this online platform.
Good evening, all. Respected Principal Madam Dr. J. Madam, Hospital Superintendent Dr. Asha Sridhar Madam, Kaumara Bhratya Department HOD Dr. Roshni Anirudhan, Dr. Leshmi, Dr. Sohini, and other staffs, PG students, and delegates to the seminar. As a part of Ayurveda Day celebrations from November 1st to November 10th, various departments of Government Ayurveda College Thiruvananthapuram are conducting so many activities, including awareness classes for students and public, and different medical camps, screening camps, school visit, etc. After the inauguration, yesterday's inauguration, there was a motivational talk by Dr. M.R. Vasanambudiri sir. And today is the beginning of national seminar by Kaumara Bhratya Department. Other programs from Hamara Bhratya Department are health checkup for schools and public awareness class and the management of developmental disabilities of children. I think the topic pediatric epilepsy is very relevant, and the name, the Smriti Tarangam, is also very interesting. I would like to congratulate all teaching staffs of Kaumara Bhratya Department, especially head of the department, Dr. Roshni Anirudhan, for conducting such a national seminar within the short time. During the first meeting itself, during the first meeting of Ayurveda Day celebration itself, at the moment, Dr. planned a national seminar. Congratulations, Dr. Roshni. I wish you all the success and blessing from my part as an Ayurveda Day program convener. Thank you.
Thank you, ma'am. And we at Government Ayurveda College Trivandrum, and especially under the government sector of Kerala, we are having a very good unity of teachers among them, and we have named it as Akhila Kerala Government Ayurveda College Adhyapaka Sankarna. Now we are proud that Dr. Seemacha, Professor of Agata Tantra, is presiding that teachers union, and she will be blessing us during this occasion. Welcome, Dr. Seemacha Madam.
Thank you, Dr. Roshni. Good evening, all. Respected Principal, Dr. J. Madam, Dr. Asha Sridhar Madam, Dr. Sheila Madam, Dr. Roshni, and other faculties in the Department of Kaumara Bhratya, and good evening to all the delegates who are participating from around the country. It's happy to know that the Department of Kaumara Bhratya is conducting a national seminar in connection with the 8th Ayurveda Day celebrations in a short notice. The seminar addresses, as you all know, it's a very challenging topic in the pediatric practice. That is the management of pediatric epilepsy. I hope that the seminar will draw some valid insights to the participants. And in this occasion, I express my wholehearted felicitations and success to this online 1 week long seminar on behalf of the Akhila Kerala Ayurveda College Teachers Association. Thanking you all. Thank you.
Thank you, Dr. Seemacha.
Yes.
Now, PGs, postgraduates of the department, are always our strength, and we are blessed to have 6 postgraduate seats from Kaumara Bhratya every year and 2 PG diploma seats over there. So, Government Ayurveda College Trivandrum is having post-graduation in almost all subjects, and so I welcome the President of Postgraduate Student Association, Dr. Adina, to felicitate this occasion. Please.
Thank you, ma'am. Good evening, one and all. Respected dignitaries present over here and the delegates of Script 2023. I deem it a great honor and privilege to felicitate this session today. As you all know, as a part of 8th National Ayurveda Day celebrations, a wide variety of programs are being conducted in different parts of India. So, to come up with new initiatives, the Department of Kaumara Bhritya of Government Ayurveda College, Trivandrum, is conducting a CME on pediatric epilepsy. Kaumaripsya, as we all know, is one of the most important branches among Ashtangas of Ayurveda since ages, and now it is in its developmental phase. It's gaining a wide popularity and acceptance among the common people. And it's a great sign that people are more into Ayurveda pediatrics. And as Ayurveda physicians, it's high time that we should start focusing more on this branch of Ayurveda so that we will have a great development in the near future. Let Smriti Taranka, the national CME, be a contributing factor and a great start to our future contributions. Wishing all a happy and great learning experience and best wishes for the entire CME sessions. Have a great time. Thank you.
Thank you, Dr. Athena. Now the PG Diploma Students Union, they are the future clinicians, and they are going to practice Kaumara Bhritya in the grassroots level. So I welcome Dr. Varsha Mohan, the Secretary of Postgraduate Diploma Students Union, for the felicitation. Please.
Thank you, ma'am. Good evening, one and everyone. Respected teachers and my dear friends. We all know that children's health that forms the backbone of a nation's welfare as they are the future generation. And through meticulous practices, our Kaumarapratya department act as one of the strong pillar in our Ayurvedic field. So, on the behalf of the PGDSA, Government Ayurveda College Trivandrum, I convey my good wishes to the organizers as well as participants of the program, Smriti Tarangam, and I wish a great success for the event too. Thank you.
Thank you, Dr. Varsha. Now on to the House Surgeons Association, the budding doctors learning the nutshell of Kaumara Bhritya in a short period of hours. So I welcome Dr. Nandu Vijay, the Secretary of HSA, to felicitate the occasion.
ഇതിലെ ഓൺലൈൻ പ്രോഗ്രാമിനെ എത്തിച്ചേർന്നിരിക്കുന്ന എന്റെ വിദ്യാർത്ഥികളെ, ഈ ഒരു പ്രോഗ്രാം ഞാൻ ഇപ്പോഴും ഡ്യൂട്ടി കഴിഞ്ഞ് ഫോൺ ഒന്ന് തുറന്നു. അപ്പം മാം ഷീല മാം നേരത്തെ പറഞ്ഞ പോലെ ആയുർവേദ ഡേന്റെ ഒരു പ്ലാനിംഗ് കമ്മിറ്റിയിൽ രോഷ്നിയും പറഞ്ഞായിരുന്നു ഓൺലൈനായിട്ട് നമുക്കൊരു നാഷണൽ സെമിനാർ കണ്ടക്ട് ചെയ്യാമെന്ന്. അപ്പം ഫോൺ തുറന്നപ്പോൾ ഞാൻ ഇപ്പോഴാണ് അറിയുന്നത് അതിന്റെ ഒരു പരിപാടി സ്റ്റാർട്ട് ചെയ്ത് കഴിഞ്ഞു എന്നുള്ളത് തന്നെ. അപ്പം വളരെ സന്തോഷം തോന്നി. ഈ ഒരു ചെറിയ ടൈം ലിമിറ്റിനുള്ളിൽ തന്നെ ഇങ്ങനെ ഒരു പരിപാടി 7 ദിവസം നീണ്ടു നിൽക്കുന്ന ഒരു പരിപാടി കൗമാര വൃത്യ ഡിപ്പാർട്ട്മെന്റിന് കണ്ടക്ട് ചെയ്യാൻ കഴിഞ്ഞു എന്നുള്ളതിൽ. അപ്പം HSAയുടെ ഭാഗത്തുനിന്നും എന്റെ ഭാഗത്തുനിന്നും ഈ ഒരു പ്രോഗ്രാമിന് എല്ലാവിധ ആശംസകളും നേരുന്നു. താങ്ക് യു.
Thank you, Dr. Nandu. It's a team effort which works behind. Thank you on behalf of the department. And now the college union chairperson, and Dr. Anasuya PJ to felicitate the occasion.
Good evening all. Respected Principal Dr. JG ma'am, Dr. Ashina and Dr. Roshina and other dignitaries. I convey all my regards to the Department of Kaumara Bhritya on conducting this 1-week national level seminar, Smriti Tarangam, on the topic pediatric epilepsy. And on behalf of College Union, I thank Roshni ma'am for organizing these informative sections for us students. I hope this national level seminar will be a huge success. Thank you, ma'am.
Thank you. Now I invite Dr. Sohini, our associate professor. She is on exam duty and at a faraway place, but she is with us to convey her regards. I welcome Dr. Sohini, madam.
Thank you, madam. Good evening to all. Okay. Good evening to all. So I came to the. Ma'am, I'm audible.
Yes, yes, ma'am.
Audible,
Yes,
madam.
yes, Sohini
Okay.
doctor, you are audible.
Now we came to the end. Okay. Okay. Now we came to the end of the session of inaugural function on the CME on pediatric epilepsy, which name is Smriti Tarankam. So, first of all, I would like to express my sincere thanks and gratitude to Dr. DJ, Principal, Government Ayurveda College, Thiruvananthapuram, for inaugurating the CME and spending the valuable time for this function. And I would like to express the sincere thanks to Dr. Asha Sridhar, Superint, WNC Hospital, Pujapura, Thiruvananthapuram, for the felicitation. And also, I convey my sincere thanks to Dr. Sheila, HOD, the Department of Swasthavrita, and the convener of National Ayurveda Day, so for giving her a valuable support for this program. So I would like to express my gratitude to Dr. Seemaja ji and the President of AKGA CAS TVM unit for the felicitation. And I would like to express and I convey my thanks to Dr. Lakshmi MK, Associate Professor, for her warm welcome speech. And I express my thanks to the members. That is sincere thanks to Dr. Adhina Chandra and Dr. Anurag Kesar and Dr. Nandu Vijay and Dr. Sijil Dev TM for the felicitations for this program. And this program is organized by the initiative of the department, especially HOD Dr. Roshni Anirudhan, or the other staff and PGs of the department. So hence I would like to express under the opportunity, this opportunity to express my special thanks to our all the members of the KB department and especially to our HOD Dr. Roshni Anirudhan for her constant support and initiative and motivation. So finally, I express my convey my thanks to the government, the staff of the government of the college Kannur to giving an technical support for conducting this inaugural function and the coming CME program. Okay, thank you.
Thank you, Dr. Lakshmi. Dr. Sohini, now we are completing the inaugural session, and without wasting time, we'll be directly going to the scientific session. I think we are on time. So I am happy to welcome Dr. Reena Kulkarni, our own PG from Government Ayurveda College, Trivandrum, and the first batch of PG when it started in way back in 2004. And handing over mic to Dr. Lakshmi for introducing the speaker.
Thank you, ma'am. Dr. Reena Kulkarni, ma'am, Professor and HOD, Department of Kaumarabhritya, SDM Institute of Ayurveda and Hospital, Anjepalia, Bengaluru. She has a meritorious academic profile throughout the elementary and professional education. She has completed her UG from Sri Kala Bhairaveshwara Swami Ayurveda Medical College, a hospital, Vijayanagar. She College Trivandrum, and she pursued her PhD in 2015 from NIA Jaipur. She's also having MHC in clinical child development from CDC Medical College Trivandrum, and she has guided 11 PG research works with a teaching experience of more than 15 years. She has been a part of various research projects Mutra, impact on Prakriti on nutritional status in children, and so on. She was awarded with the Certificate of Excellence for the year 2013, 2014, 2015, 2016 at SDM College, and she was also awarded Kumararatna Award by the Association of Ayurveda Professionals. Over to you, ma'am. Reena, ma'am.
Dr. Reena, can you unmute yourselves? Please, can you unmute?
Am I audible?
Yeah, now you are audible.
Namaste all. Today is a special day for me. Before starting the session, first of all, I would like to wish all the Keralites, probably all South Indians. Uh, Happy State Day. Today is the state day for all the South Indians. And double happiness because going to be a part of my mother institute. Is the voice okay now?
Now it's okay. Now it's okay.
So, to be a part of my mother institute, it gives a pleasure to me. And at the outset, I would like to thank Dr. Roshni Madam and her whole team, including Dr. Sohini, my good friend, my classmate, Dr. Lakshmi, my junior, my good friend, and all other in the team for organizing such a swift program on the part of National Ayurveda Day. I also thank for giving me this opportunity to be part of this one challenging topic, which is discussion by Roshni Madam. It seems to be her favorite topic. And without taking much time, I would like to straight away start my presentation for the day. Is PPT visible, ma'am?
Now it has not come. Can you try once more, Dr. Reena?
Yeah.
Yeah, I think now it's coming.
Did it come, ma'am? Is it visible?
No, the
I'm not able
PPT
to
has
see.
not come actually, but that presentation format has come.
Just redo it, ma'am.
If you can share a window, I think that will be fine.
Hope it has come now.
Not yet visible. Maybe it will take a second or so. Now it's coming. Now it's coming. Yeah, it's coming. It's visible. It's visible.
Yeah. Yeah. Thank you. Hope the slides are moving.
Yeah, moving. It's clear. And you are perfectly audible.
Yeah. Good evening, everyone. Yeah. Today the topic for presentation for me is Apasmara in Bala, a clinical approach. Seems to be one of the very interesting topic, one of the most challenging clinical conditions too. Many children approach Ayurveda doctors for help, especially in stages. And so far, there is no established protocol for Ayurveda management. All of us treat Apasmara, but none of us match each other. So that has become the greatest challenge. And classical medications are being tried sometimes, and sometimes most of the things we stop using that for the reason that we are not really sure or confident of using these medications. Apasmara chikitsa is most read but less understood clinically. Difficulty to adopt all the treatment designed in the context for children. This makes this topic one of the very toughest one for the clinician. I must congratulate the Department of Trivandrum Ayurveda College for selecting such a wonderful topic this regard. This is going to make, of course, many of the Ayurveda practitioners confident in the near future to deal with this. For today's presentation, I will be going with a little modern description, though I will not be going in detail about the physiology and clinical presentations. I feel this is needed for us to understand the Apasmara chapter in a better way. Coming to the relevance, in India, prevalence rates for about 5.59 per thousand population, and male and female are equally affected. Coming to the etiology of seizure disorder or epilepsy, and are multifactorial, and almost any incident can result in seizures.
Excuse me, Dr. Reena.
Epilepsy can result from brain injury due to infections.
Excuse me. Your sound is a bit shattered.
Yes, ma'am, please.
Your sound is not that clear, ma'am.
Okay.
Slides are perfect, it's visible, but sound seems a bit shattered.
There's a lot of echoing. Even I can hear the.
I think the problem is that you are entering from two, that one is creating that echo. If you can switch off the two and one of the other two entries, it will be clear.
How about now, madam?
Now when you are talking slowly, it is okay. The clarity is bit reduced. That echo, we can hear it. That is the problem. Now can you try? Because one is mute.
Yeah. Yeah. Now is it audible?
Yeah. Now it's better. I think we can continue.
Oh, it's clear now.
Yeah.
Yeah. Yes. So I was just telling that etiology is multifactorial. Epilepsy can result from brain injury due to any infections, hypoxia, damage, earth injury, malformations of the brain, genetic coming to the pathophysiology, the exact pathophysiology of this is still not well understood. However, it is known that seizures are produced when there is an abnormality in the neurotransmitter levels. We know that there are many neurotransmitters like GABA, dopamine, adrenergic, serotonin, acetylcholine. So these all come into play when we speak about Apasmara. Then the ion channels, which conduct, for example, sodium and potassium channels and chlorides. These are the very important which help us to connect to the
Voice is again breaking, ma'am. Voice is again
Okay.
breaking.
And let me join with some other
I think the first one was better than this one.
If the bandwidth is low, madam, it's we can try with the switching off the video. I think she left. Sorry for the inconvenience, dear delegates. We hope she'll be joining with a better bandwidth. merits and demerits of the technologies. It's due to the online platform that we can happy that we can all meet here for discussing about pediatric epilepsy. But this unexpected event usually happens. I think she is very busy in solving the technical errors. We'll wait. Welcome back, Dr. Reena.
Yes. This time it is clear audio.
It's better now, I think. If any problem is there with the net, doctor, you can cut off your video and then the sound will be more clear.
Okay.
We'll try with the video on. And
Is slides visible now?
Now it's visible and you're audible also perfectly. If any problem with the audio, I will intimate in between. The slide is also visible now.
Right now.
Perfect.
Yeah. I think I just go off video and start presentation.
Okay, that will be nice.
Yeah. Hope slides are visible.
Yeah, perfectly. Pathophysiology is going on.
Yeah. So I was just telling that involvement of neurotransmitters, ion channels and receptors in the pathology of the seizure disorder or the epilepsy. And in many of the genetic epilepsies, there are abnormalities of the ion channels or receptors due to mutations resulting in epilepsies. These abnormalities can result in hyperexcitability of neurons, which thus have a tendency to through the seizures. The other epilepsies result from neuronal damage because of the various insults like infections, trauma, and vascular events. We all know that it is the function of neurons to receive signals and fire back the signals so that an intended activity secondary to a input sensory afferent the sensation is taking place. But when that goes out of control and the neurons are hyperexcited, they keep on firing, then the motor, sensory, autonomic functions get disturbed and they can present clinically as seizures. Now, how do they manifest clinically?
Excuse me,
Yes,
doctor. Dear delegates,
yes,
if you can open that window of that slide and pin it, it will be more visible. Please open the window of the slide which madam is presenting and switch on that pin button. Then it will be highlighted. Thank you. Doctor, you are perfectly audible now. You can continue.
Yeah. Coming to the clinical manifestations, they can manifest as abnormal motor activity, which may be tonic contractions or single or repetitive jerks. So it could be a tonic contraction, which could be persistent, or a single jerk, or it could be a repetitive jerk. And the impairment or loss of consciousness or awareness. Or it can present as abnormal behavior. It can even present as abnormal sensory phenomena, abnormal sensation in the part of the body. The person may start telling that she has something like pins in his body, or there may be excessive heat in the body, something like that, Then visual phenomenon, the person may start seeing flashing lights or something unusual, or smell. Suddenly the person may say that he is smelling something good or very bad, or without anything in the mouth, the person may say that he has a sweet taste in the mouth or something like that. Then abnormal experiences in the form of fear, anger, illusions, or hallucinations. Children often run to parent when they experience such kind of features. And there could be even autonomic phenomena like loss of some activity with regards to any of the sphincters, like that. So this will be the usual clinical manifestation. They can totally manifest together in a seizure event, or any one type of them can present. Based upon these presentations, these seizures can be characterized clinically either as a motor seizures. Motor seizures could be generalized or focal or partial. So also the sensory seizures. Come to the classification, generalized, as I said, it could be generalized or focal, the main classification. Amongst the generalized seizures, the epileptic discharge can involve both the hemispheres at the same time, which we call as generalized uh, primarily, or sometimes they can start with any one of the hemisphere, and then they can spread all over the brain, and that we call as focal with a generalization or secondary generalization. So when this happens clinically, they can manifest as generalized tonic-clonic seizures. When I say tonic, there is stiffening of the body. When I say clonic, there is repeated jerking of the body. Generalized tonic-clonic means initially the person starts with a tonicity, then followed by continuous jerking. So both the events are happening. Then coming to tonic seizures, only the tone is either hypertonic, or suddenly when the person loses the tone and falls down, it is called as atonic. So in the tonic and atonic are the two conditions, the tone abnormalities are seen. And coming to the clonic seizures, where there is a repetitive flexion and extension, that flexion and extension of the joints, that means that the person is throwing the jerks. Now coming to the myoclonic jerk can happen with a single group of muscles. There may be only twitching of one hand or a wrist or a part of the body, something like that, which is called as myoclonic jerk. Sometimes myoclonic jerk can come as a single jerk or sometimes even in clusters. Then coming to the absence seizures, where the person suddenly has an absence attack. Absence attack in the sense a person who is doing some activity for a moment becomes still, and after some time the child resumes activity as if nothing has happened. Apart from this still or stare, there is no other motor phenomenon, so it has a more tendency to go unnoticed. Now coming to the focal or partial type of seizures, in this the epileptic discharge starts in a focus of the brain in one hemisphere, or a localization related seizures. That means whichever part is throwing the abnormal the firing, only that part can present with the focal seizures. So they could be in the form of simple partial seizures where the consciousness is retained. The person can be responsive to your call, but still he is throwing the seizures. Then complex partial seizures, there is always associated impairment of the consciousness. Then third one is secondarily generalized seizures. Both simple partial or complex partial seizures may evolve into generalized seizures. That means to say all these complex partial seizures can present with the four typical stages, which is called as aura. Aura means it is a person perceivable symptoms. That means the patient only perceives that. That says about the impending attack of seizure. Say for example, person may say that he has some butterflies in the abdomen, some cramping in the abdomen, or he says that some flashing light is there and he feels that something is going to happen. Then he starts with automatism. What is automatism? They are some of the associated motor events Like in this, the person unknowingly starts maybe pulling the hairs or making a lip smacking or sometimes making some oral sounds or fiddling with the cloths, rubbing something, walking or repeating a word or phrase, something like that. The things will be repeatedly being done by the patient without his awareness. That is called as automatism. Then clonic ictal phase starts. So wherein the person may become stiff, protonic, then into clonic. So jerking will be there. That is called as the main phase of the seizure. And following the main phase of the seizure, when the person is throwing the clonic seizure, there could be incontinence of the sphincters also. Then that ends with the post-ictal state. What happens in the post-ictal state? The person will be having some residual symptoms like altered sensorium, heaviness of the head, headache, or heaviness of the body, some features like this, and that can last for few minutes or sometimes for few hours also, wherein the person feels extremely tired or he may go into sleep. So this is what happens usually in a seizure attack. Now, coming to the current management options, there are newer AEDs are available, which I'm not going to detail today because there is one exclusive topic by a neurologist on this. Then there are options for surgery. When the surgery is the last option actually, when the seizures are refractory, not being controlled by combination of then people resort to surgery that could involve a removal of a part of the brain which is firing abnormally, or it could be lobectomy. Usually these things are done with frontal or usually temporal lobe epilepsies. They go in for the refractory seizures, they go in for the lobectomy. Then coming to the ketogenic diet, so that induces the ketosis by high fat and low carbohydrate diet, and which shows to have some anticonvulsant effect. So which can be used as a patya, what we say, continuously as a part of a seizure medication. Then the newer modality is vagal nerve stimulation. Device is implanted under the skin in the chest with a coil round the vagal nerve. This keeps on, activated when the impending seizure is there by a magnetic across it. Then the impulse is generated that stimulate the vagus nerve, and thus, they are going to control the seizure. So these are the current options available. With this background, we'll go again with Apasmara. And three terms we should know clearly before getting into Apasmara. What is that? A seizure. Seizure means a clinical manifestation
Hello, ma'am. The
of an
slides are not
abnormal.
visible.
Excuse me.
Hello, ma'am.
I
The
think
slides
it
are
is
not
visible.
visible actually.
No, slides are visible. Please click on the Madam tab and you make it full so that you can visualize. Visible for all. Please continue, Madam.
Yeah.
Please continue, doctor. It's visible.
Then coming to okay, seizure means it is a clinical manifestation of abnormal, excessive, or paroxysmal electrical discharge from the brain. This electrical discharge is conducted to the body and produces seizure. It could manifest in many different ways, as we have discussed earlier: motor, sensory, psychomotor, or autonomic. Now, coming to the epilepsy, when the seizure attack has a repetitive occurrence, especially at an interval greater than 24 hours or even apart, for which there is no immediate precipitating cause. So then we call a seizure as epilepsy. And coming to convulsion, convulsions is a seizure with a predominant motor manifestation. So these things has to be kept in mind when we discuss about the further things. Now, epileptic syndromes are those where the syndromes which have some other clinical manifestation, but epilepsy being the prominent features. Then coming to idiopathic epilepsies, now they are known as genetic epilepsies because the underlying cause is except a genetic predisposition to the epilepsy, there are no identifiable causes. Then coming to symptomatic epilepsies, they usually present with the structural malformations of the brain or post-meningitic sequel or the post-hypoxic ischemic encephalopathy. That means to say that a baby can be born with a congenital or brain anomaly. He may be having some other disease, but he will be presenting with the symptoms. And that other disease has a typical name. While in case of epileptic syndromes, the syndrome itself has a main feature as an epilepsy. Say for example, symptomatic epilepsies, we have Aicardi syndrome, so or Ohtahara disease. So they are identified, but because of the brain malformations, they are throwing the seizures. Then coming to the cryptogenic epilepsies, there are no causes are identified. Nowadays, these cryptogenic epilepsies, which presents with the infantile spasms, they are called as epileptic spasms. Then we have provoked or acute symptomatic seizures that can be occur during the course of acute illness. For example, meningitis, encephalitis, head injury, and all. These patients can present with, or even cerebrovascular accidents. These patients can throw with the seizures, and they are called as provoked or acute symptomatic seizures. Now moving on to Apasmara, the definition goes like this. The Nirukti, Apagata smaro yasmin roge so apasmara. Disease which predominantly manifests with a momentary loss of smarana shakti. So that is called as apasmara. What is that smarana? Smruti means smruti, bhutartha vijnanam, apascha parivarjana. The awareness about the sensations, the sensory activities and the surroundings and the person existence itself is called as smruti. And wherever the condition, the smruti gets hampered, that person is said to be in apasmara. And this Vyasi is called as Antakru. That means it's one of the grave disease. Apasmaram punaha smruti buddhi sattva samplavat. Bhivatsa chested. How does it present? Is it just only the alterations in the smruti? No. It could present with a loss of buddhi vapara, loss of sattva chesta, and motor, it can present with a bhibatsa chesta, abnormal movements associated with avastika tamapravesham, a momentary loss of consciousness also. Smrute rapagama prahur apasmaram vishagvidaha tamah pravesham bhibatsa chesta dhi sattva samplavat. These are the definitions we get in the context of apasmara in various samhitas. Then coming to the Nidana, that means to say we come to a conclusion that Apasmara is a Vadi. There is the Smruti gets hampered. There is Avastika Tama Pravesha. The person goes into lack of awareness momentary. It could be associated with the Bhibatsa Chesha. This is what is Apasmara as per the definition. Now what are the Nidanas explained? Mithya Atiyogat इंद्रियार्थ कर्मणा अभिसेवनात् विरुद्ध मलिनाहार विहार कुपितै मलैहि एक निग्रहशीलानाम् अहिता शुचि भोजिनाम् रजस्तमो अभिभूतानां गच्छतां रजस्वला. If we look into this, we feel that it is as good as any other disease that can manifest in physical disease in Ayurveda. So now, if we just go into the Tika, it says Indriyarthanam Sparshadinam Karmanam Kaya Vang Manasam. It says Tatra Purushe Ishta Vinashadi Shravanam Mithya Yoga. So what is the Mithya Yoga of Indriya? If we take an example of Shravanendriya, Parusha Anishta Vinashadi Shravanam Mithya Yoga. Patahadyati Shabda Shravanam Ati Yoga. That means listening to high pitched sound. Then Sarvasho Ashravanam Ayoga. This can happen with any of the Indriyas. Then Tata Manasa Karmanaha. Shokadi Chintanam Mithya Yoga. Continuously being in grief, stress, anxiety, so that is called as Mithya Yoga. Atimatra Chintanadikam Ati Yoga. Then Sarvata Achintanam Ayoga. Being carefree, nothing taking, this one is called as Ayoga. Similarly, Malinahara. What is Malinahara? Puti Dveshtam Amedya Parishita Malina Viharo Drushta Drushtartha Smartha Vachanat Gnatavyam. So, Malina Ahara refers to that which are stale food, mixed unclean food, which is amedhya. So, such kind of food, if you are continuously indulging, that is definitely going to hamper the sattva vyapara. So, Kupiter Malai Mala Vatapitta Sleshmano Radhastamasisha. So we know that Sattvam cha Shariram cha Sattvam. So that means whichever the influences which we see on the Sharira can directly influence upon the Sattva. So the food habits or the activities can vitiate the doshas. They in turn vitiate because we have close relation between Rajas and Tamas with the Sharirika doshas and Sattva also. So they can inter-vitiate each other, right? So then there are some triggering factors are also mentioned. So now if we go into the current concepts of epilepsy also, we know that there are some conditions like, visualizing the flashing lights, color lights can trigger epilepsies, especially partial epilepsies in children. Similarly, listening the high-pitched sound also can trigger. Similarly, the what is it? Excessive blowing, that is hyperventilation, can also trigger the seizures. In fact, they are used as a diagnostic maneuver in confirming the type of seizures also. Now, apart from this, there are some triggering factors are also mentioned. They are like kama, krodha, bhaya, lobha, moha, harsha, shoka, chintana, udvegadihi, sahasa abhipurayanti, jantu, tada apasmarati. So, when a child is having the inherent vitiated doshas, if he is exposed to any of these events, that will further trigger the doshas, and that at that event, the person ends up in having apasmara. We all know that whenever we have the sensory inputs from external world, it is our reticular formation area, more or less compared to the Shringataka Marma. So that connects to the cerebral cortex and it activates the respective Indriya, the site of Indriya, and we have the respective motor information from the motor cortex to the body, and that the person shows the activities. Now, what happens with that triggers? It happens so that the inhibitory system in our brain fails to control this input of continuous influx of these sensation, and motor cortex keeps on firing, and that exhibit clinically as seizures or apasmara. Then coming to the Purva Rupa, Rutkampaha, Shunyata, Swedo, Dhyanam, Murcha, Pramodhata, Nidranashasya, Tasmin Bhavishyati, Bhavantyataha. So this again is complained by many of the people with the epilepsies. Rutkampaha, this Rutkampaha can be taken as a again, when it comes to the word Rudaya, Rudaya is a seat of emotion, which can be taken as heart, which can be taken as the cortex, as I was telling, which can be even taken as the reticular formation area, which receives all the sensory inputs and that converts it into the corticular sends to the corticular tract to the respective motor cortex centers. So these are the areas could be taken as Hridaya. So any events that is going to disturb this area, the momentary what happens, the person goes into confusion. So Shunyata. Then there could be abnormal autonomic presentations in the body, and in the state of confusion, sometimes he can even go into syncope, and deeper syncope, which is called as pramodata, and this could be the initial features, and sometimes the sleep deprivation can also manifest with the impending seizures. So tamaso, that's even in Ashtanga Sangraha, he has added some more points like Bhruva Vidasaha Akshivaikrutam. Initially, the person can start, it can usually happen in Jacksonian types of seizure march, where the seizure can start with any of the peripheral smallest part. There could be simple twitching of the toes or the fingers or the eyelids, which then later there could be abnormal rolling of the eyes, then which later can generalize into the hemispheres and then can present as a seizures. Ashabda Shravanam, so that could be auditory hallucination, which a person perceives as an aura that is impending to the future seizure attack. There could be sometimes, continuous salivations from the mouth. So then there could be some abdominal discomfort in the form of atopa, adnan, or sometimes even a mild pain. And sometimes even before the person goes into the tonic-clonic phase, the person may lose the tone and become momentary loss of tone and then suddenly start with a seizure. Usually this happens with the partial, complex partial type of seizures. So this is about the Purva Rupa, which is mentioned in our science. Then moving on to the Rupa, Sangna Vaheshu Srotasu Dosha Vapteshu Manavaha Rajastama Pariteshu Mudo Brantena Chetasaha. So Vikshipan Hastapadam Vijimha Blue Vilechanam then Tanthan Kadan Vaman Penam Vivratakshaha Patet Kshito Alpakalantere Chapi Punaha Sanna Labeta Sahasu Apasmara. It is so beautifully explained. She says there could be Rupa. When we speak about Rupa in Ayurveda, we know that a disease can present with a few of the feature, any one of the feature, or including all the features which are described, it can present. Now, the person can simply present with mood or mohayuktaha, momentary loss of awareness, consciousness. He stands or sits still and then continues with the activity. Brantena chetasaha chitta brante ityartaha. Sometimes he can abnormally move here and there. He can throw anger spells. He can throw the objects and then suddenly calms down. So that could be another form of presentation. That is a sensory presentation. Then Vijimhabru Vilochana Vakrabhunetrata. So the focal epilepsies, there could be only the tightening and twitchings of the brow and the eye, or Vakrabhunetrata, or the abnormal rotatory movements of the eyes. Then Vikrutakshaha, Uchalitakshaha, that is the uprolling of the eyeballs. Then Aturaha, Kshitau Patati Saha, the person who is sitting or standing suddenly falls off due to Balakshaya. So that is again one of the feature. Then Avipako, Aruchihi, Kukshatapu, we have already discussed this. Then once the person falls, he can have Vikshipan Hastapadaha. So he can have alternative jerking movements of the body along with the Dantan Khadan. In the tonic phase, there could be the biting of the teeth as well as the tongue. Vaman, though there could be at the end of the seizure event, there could be due to loss in the clonic phase, due to loss of the sphincter control, the person may vomit or even pass urine and feces. Phenum, that is the frothing from the mouth, could also be seen as a clinical feature in Apasmara. Now, coming to Samprapti, please bear with me. There is some abnormal placements of the arrows. So initially, it can start with a Damini Vihi Shrita Dosha. So because of the Nidana, the vitiated dosha, they are seated in the Dhamani. Sangnavaheshu Srotasu Dosha Vapteshu Manavaha. So Sangnava Srotas gets affected. With all this basic knowledge, I felt that this Sangava Srutas could be the reticular formation area. Rajastama Pariteshu, when it is getting abnormally stimulated by the emotional events. Then Rudayam Pidayanti, it causes the disturbance in the local area. Sampidamano, with the disturbance, the person becomes Moodaha Prantena Chitasaha. Then the following events of Apasmara goes on manifesting. So that could be in the form of absence, sensory, tonic, or clonic, or finally generalized tonic-clonic. So once the Vega, or the seizure event is completed, dosha vege cha vigate suttavat pratibuddhate. The person will get up as though nothing has happened, and he may have complete amnesia regarding the event which has happened. He may be asking, what happened? I was just sitting here, something like that. So this is the total of the events described in the Samplapti of Apasmara. Now, based upon the dosha, this Apasmara is classified into Vataja, Pittaja, Kaphaja, and Sanipataja. Now, Vishesha Lakshana based on doshas are also mentioned. In Vataja, predominant features are Vepamano, Dashan. So that means the motor features are there associated some psychomotor features. Then something like Sattvam, Krishnam, Mam, Anu Dhavati. So something like the visual hallucinations, or sometimes even auditory hallucinations. He says something which is black is approaching me, or it is threatening me, something like that. The person will be presenting in case of Vataja Apasmara. So Ruksha, Shava, Aruna, Akshi, Twang, Nakha, Ase, Krishnam, Vikshate. So there could be some autonomic disturbances could also be seen. Chapalam, Parusham, Rupam, Virupam, Vikrutanaha. This is again the visual features could also be associated with the Vataja Apasmara. So either it can present as simply Kampa, Pradashet, or something like local the tonic-clonic movements, or we can also the continuous seizure attack associated with the psychomotor phenomenon. So this is how we understand motor sensory activity, psychomotor activities, and there is no mentioning of the automatism mentioned in the Vataja Apasmara. Now moving on to the Pitta dosha, Pitta Japasmara. So there is Pita Fenanga Vaktrakshaha, Pitasra Grupa Darshanam. So everything which is the Nanatmaja Guna and Karma of the Pittas are being explained in the context of Paitika Pasmara. He says Muhu Sangnacha Vindati. So he says Apasmarati Pittena Muhu Sangnacha Vindati. So there is the tonic presentations, but the period of loss of awareness will be less as compared to that of the Vataja Apasmara. So Bhairava, Deepta, Rushita, Rupadarshi. So these are the flashing visual manifestations are seen with regard Apasmara. So Apekshnam Apasparantam. So there are the severe manifestation of the seizures, but Kshanena Sagna Labate. So comparatively to Vata, the person will get the consciousness quickly. There are some psychomotor phenomenon also mentioned, like movements as though the person is having Trishna. Then Aspalayati Medini. So he keeps on rubbing the clothes or the boo itself, where the place where he is laying down, he can keep on rubbing the area. Now moving on to the Kapha dosha, Shukla Fenanga Vaktrakshaha Shito Prushtangajo Guruhu. Pasya Shuklani Rupani Slaishmiko Muchate Chirat. So the amount of motor activities is less in Kaphaja Apasmara, and the period of loss of consciousness will be prolonged as compared to Vata and Pitta. And then there could be increase of the event with the exposure to the things which increase the sleshma. So even here also chirada pasmarantam aspalayantam bhumi is a psychomotor phenomenon mentioned. So there is no typical automatism is being mentioned in the all the three types of apasmara. Now coming to Sannipata Apasmara, Samavayah Sarvadosha Prakopaje. So there will be all the lakshanas seen in case of Sanipataja. Coming to the periodicity and Sadhya Sadhyata, Pakshadva, Dwadashahadva, Masadva, Kupita this event as and when the triggering factors are there, as and then when the dosha utklesha is happening, the person can manifest clinically as apasmara, which could be within 2 weeks or 12 days or 10 days or 1 month, or sometimes it can even be 6 months, 1 year also. Clinically, what we see. Then reason for periodicity, as it is said, whenever he says wherever the in the Varsha Kala, wherever the bija is there, the bija gets the sprouted. In the same way, the doshas are vapta all over the body, but whenever they get aggregated and they get a proper trigger, they will fire, and that manifests as apasmara. Now coming to the Sadhya Sadhyata, Apasmara is described as one of the Mahavyadhis because of the complexity in its management, and the Asadhya Lakshana is also mentioned in Charaka Indriya Sthana for Apasmara. Now coming to the Apasmara and the other contexts of pediatrics, there is something called as Akshepaka, Muhur Akshepati Kruto Gatrani Akshepako Anilaha. When we come across, we know that initially in the Apasmara chapter he said dosha vega vagate suptavat pratibuddhate, and the person will not have any residual symptoms unless until he gets the next attack. But when he has a residual symptoms or he keeps on manifesting it, it goes into a structural deformity, and that is considered as a Vata Vyadhi and explained as a Akshepaka in the context of Vata Vyadhi. Then in the context of Visha also we find that Sanna Pranasha Subrusham Chati Sagyate. So this is Saptama Vega. It is mentioned Shashta and Saptama Vega. We find the sensory abnormalities in Visha. And in case of Jwara, Vikshepanaha Gatrana Shashastastivate Jware. In Asti Majjagata Vyadhi, Jwara, we find the Vikshepana as well as Ati Tamasa Darshana is mentioned in the context of Tivra Jwara involving the Asti and Majjadhatu. And coming to the Balagraha concept, this is again one of the unique thing explained in the context of pediatrics. We have one the Graha named after Apasmara itself has come, the Apasmara, wherein typical features of Apasmara are mentioned, but with one clause that it will present with a fever. We know that all the grahas will present with a fever, and it is known that Balagraha is something which is doing avesha to that means it is inflicting the person from the external. So most of the current concept in Balagraha states that Balagraha could be viewed as a acute infective syndromes in pediatrics. So it could be, even they say that Puya Shonita Gandaha. So there could be possibilities of any sepsis or any infective conditions which can present as apasmara. Then, so also in case of Naigamesha Graha, we have Urdvam Niriksha Hasanam Madhya Vinamanam, the tonic nature of the seizures are explained in Naigamesha Graha. And coming to Kampa, this one, Shwagraha, again, Bahirayamanam, Jivadam Shloantaha, Kantakujanam. So the typical things which happens in the tonic seizures is again explained in Shwagraha. Then coming to the Pittagraha, Pitrugraha, so Angeshu Akshepa Vikshepaha, Shoshaha, Stambhaha, Vivarnata. So the multisystemic syndrome is seen with the Pitrugraha that can even present in its severity as a Apasmara. Then coming to the Revati, Revatya Shavanilatvam. So he says Akshepaha, Vikshepaha, Vakravatrata. So this is also one of the graha which presents. Now we just look into the various manifestations. We have the structural or some permanent deformity in the Vatasthana that can present as Akshepaka. Then we have Visha, then we have the infective fevers, then we have the Balagrahas, which all can, in the Balagrahas, again we have that which can inflect the CNS. Then we have something like, Revati Graha, though which even in Putana also the Vikshepa is mentioned, where the cause for the Apasmara, the cause for the seizure event may be totally different. It could be earlier, it could be the CNS involvement, and now infective environment we have seen, and coming to this Revati and Putana spectrum, it could be the loss of electrolytes from the body in the form of Atisara, because all these manifest with the majority of Atisara and charge. So where there is a variations with the electrolytes, that can also manifest as Apasmara. Now coming to Aragya Kalpadruma, again the celebrated traditional text of Ayurveda from Kerala. I will not be explaining in detail regarding the Aragya Kalpadruma because we have one exclusive session on this. So 18 types of Apasmara are being explained, and the clinical manifestations have been the basics for the classification of 18 Apasmaras in Aragya Kalpadruma. So the example just to mention is in Panchama, Panchadasha Apasmara, he mentions that it will start with one part of the extremity and then the whole body involves. The typical Jacksonian march is explained. In Chaturdasha Apasmara, he says generalized tonic-clonic jerks. In Trayodasha Apasmara, he says tonic jerks. And in coming to Dashama Apasmara, typical psychomotor epilepsy is described. Coming to the Tritiya Apasmara, the complex partially, we find some automatism being explained in the context of Apasmara. And coming to the Prathama Apasmara, is when typical the person suddenly falls, the child suddenly falls and loses consciousness. So atonic seizure is explained in Aragya Kalpadruma. Now coming to the diagnosis, most of the thing based upon these clinical features, Apasmara has to be diagnosed clinically with a history and the manifestations, but we need to confirm whether it is really the seizure disorder that is Apasmara or not. For that, the investigations is required in the suspected cause. Then electroencephalogram is considered as the most sensitive thing to diagnose seizure disorder. But one thing we have to keep in mind that the normal EEG does not rule out Apasmara or the seizure disorder. Most of the conditions, EEG identifies the abnormal electrical events and diagnoses the Apasmara, but the absence of it being normal doesn't mean that the person doesn't have Apasmara. Now, in case of special provocation procedures are used like sleep deprivation, cortex stimulation, especially to diagnose the partial seizures and complex partial seizures. Now, in case of intractable or refractory epilepsy, video EEG is considered as the most diagnostic because in the interictal space, again EEG can be normal. But the person, when continues to have seizures, it is better to go with a 24-hour video EEG monitoring. So, with that we can differentiate what are the normal things which can show with the spike wave discharges and what are the exact typical cases where the spike wave discharges are seen. Now, apart from this, in case if the refractory EEGs, one can even go ahead with the neuroimaging techniques. Most probably, MRI is preferred, and CT also in some of the cases can be used to identify the seizure focus. And in case of genetic disorders, metabolic and genetic tests are being the latest trend to diagnose GVC. We have in case of Dravet syndrome and all, so they typically presents with a abnormal gene. Now coming to the Chikitsa Sutra, hope it is being followed and I am audible to all of you. Now moving on to the Chikitsa. Tairavritanam Rutsroto Manasa Samprabodhanam. Now the Chikitsa Apasmara is divided into two phases. One, that is the Vega Kalina Chikitsa and Avega Kalina. The first line of Chikitsa Sutra, Taira Avritanam Rutsroto Manasa Samprabodhanam. Whenever there is a possibility of impending apasmara or the person is throwing apasmara, Tikshna Radho Vishak Kuryat. So, something which we can do, Manasa Prabodhana, can be utilized. So, that is what some Nasya Yogas are mentioned in the classics that can be utilized in the Vega Kalina for the Sattva Samprabodhana. Maybe when the abnormal sensory inputs are going on and the motor cortex is firing, if you are giving one more sensory irritant stimulation to the body and the reticular formation, the sensory inputs and that brings down the seizure attack immediately. That might be the concept behind the Vega Kalina Nasya. Then after that, once a person is settled down, then one has to do Tikshna Shodhana procedures, which includes Vatikam, Basti Bhuvishte, Pittam Prayo Virechine, Slaishmikam, Vamana Prayer, Apasmaram, Gopachan. That is typical dosha based treatment is mentioned. Prabodhanam iti dosha virahitattvena samyak vyapara. That's what. So Tikshna some prabodhana means and that moment, that particular procedure is going to trigger the sensory input so that the person gets awareness back. Then Tikshna Rubayato Bhagaihi Shiraschapi Vishodayat. So for this, one can use Shiro Virechana as one of the modality followed by Ubayato Bhagaihi. First Tikshna Shiraschapi Vishodayat could be taken for Vega Kalina as well as Avega Kalina also. Then Tikshna Rubayato Bhagai again referring Ashwati Yogan Samshamanan Shru. So after that one has to start with the Shamana and Rasayana Yogas. Now we have the first medication in Charaka Samhita which is explained as the Panchagavya Gruta. And incidentally I came across one standardization study on Panchagavya Gruta which was exclusively done on the seizure disorders, and that says that Panchagavya Gruta is known to have its effect on the seizure activities. So that is one of the thing. Then Mahat Panchagavya Gruta is also mentioned. Then we have certain other indications like the Purana Gruta, Brahmi Gruta prepared using the Purana Gruta is also one of the handy choice for the treatment of Apasmara. And then Saindava Ingubam. See beauty of this one. When he described about a Panchagavya and Mahapanchagavya Gruta, we know that in the Samhitas, the thing there was no clear-cut indication that single dosha has caused with this one. So because whenever we speak of Vataja, Pittaja and Kaphaja, the almost all Tivra Akshepaka features are mentioned. So Mahat Panchagavya Gruta, which has a capacity to control all the or Panchagavya Gruta, all the three doshas is given the first choice of predominance. Then comes is the Purana Grita processed with the Brahmi, Vacha, Kushta, Shankapushpi, the excellent Nidarasayanas who are scientifically proven to be anti-epileptic. Then comes Saindava Hingubhyam Vashe Vaste Chaturgune. See once again, very beautiful. So whenever we speak of the pathologies involving the cation influx mechanism being disturbed, think of using the Hingu and Saindava, or even we know that clinically we use Ingvashika Churna itself in many of the cases of Apasmara. So that can be utilized. Then Vata Shampaka criteria, Vayasta Hingu Chorakai, this again Palankasha Yukta, the one of the Gruta is mentioned. Again, Vacha is one such drug because of the presence of the Acorus, the chemical constituent, which is beta estrone, known to be one of the excellent anti-epileptic drug, which stimulates the GABAergic system. So, Vachadigrita, and throughout the chapter of Apasmara, we find majority Gruta yogas only. I remember our Guru Vasudeva Nambudiri sir was repeatedly telling in all the seminars when we were doing PGs that only two things can raise the central nervous system, either Gruta or Madhya. Madhya we cannot expect to be given as a long-term treatment in all these conditions. So the best option is Gruta. And we also know that the myelin sheath and its relation with the Gruta and all. So again, one of the best choice of drug. Then Thylaprastham, Grutaprastham, Palonmita. See, when the seizure and Ashtanga Sangraha, at the end he mentions when the seizures are intractable with predominant of Vatika features, then it is better to go with either Mahasneha, Siddha Gruta, or Gruta like this, Yamaka Grutas can be utilized to treat these conditions. Then Vata Pittajaha, Apasmara, again Kashmari Gruta is mentioned. Then Vedari Ikshurasha, Kvata Gruta is also mentioned in the context of Vaitika Apasmara. Then Madhuka and Amaliki Kalka Siddha Gruta is also mentioned specifically in the condition of Pittaja Apasmara. Then coming to various external procedures are mentioned, Snana, Abhyanga, Pradeha, Pralepa, so many things are mentioned. So we have Sarshapataila with the processed in Bastamutra again is considered again a lot of sensory inputs which are going to change the patterns of the seizures. Then Katabhyadi Taila is also mentioned. Purana Sarpis for both Pana and Abhyanga is mentioned. Then Shigruvadi Taila is again mentioned. Then there are some the Tailas using the animals, which I am not going to highlight because we know that animal protection is strong in India now. Then coming to Dupana, various Dupana yogas are mentioned. Then for Nasya, Kapilanam Gavamutram Navanam Param. Again, the irritant Nasya is mentioned. Then similarly, the Bhargi Vachan Agadanti Vishanika mentioned, Jyotishmati Taila is mentioned. Then Pippali Vrishchikali Kushtam Lavana Nicha Churnitam Churnanasya Pradhamanasya, especially in the Vega Kalina, one can utilize the Pradhamanasya for the treatment of this. Then Netranjanavarti is also mentioned. Then finally, Siran Vidyat Prapta Mangalyani Chadarayet. So Siraveda is mentioned in intractable seizures which are not responding to the Vega Kalini Chikitsa. So for that he says Uro Apanga Lalatajam Siram Vidyat. One can do the Raktamokshana in the Sira, either in the Ura Pradesha, Apanga Pradesha, or in the Lalata. So these are the things, and in the Siravela Vidhi Adhyaya, we also mentioned that in the temporal area, Siram Vedyata, that is also mentioned. These are the references regarding the Siraveda or the Raktamokshana in the treatment of Apasmara. So Sheelaya Taila Lashanam Payasa Va Shatavari. Brahmi Rasam, Kushta Rasam, Madhu Vacham Va Madhu Sametam. So there are some Shamana yogas are also mentioned for the later part of the treatment of Apasmara. Then Kushmanda Swarase Sarpir Ashtadasha Gunam Shrutam. So this, again, one of the study has been done on the Kushmanda Swarasa Siddha Grutha with the HT Kalka, and it is proven to be anti-epileptic. Now, caution. There is a caution also mentioned in the classics. Jalagni Druma Shailebhyo Vishamebhyastutam Sada Rakshid Unmadinam Chaiva Sadhyaha Pranaharam Hite. That means one should not allow the person with apasmara to go near the Jala, Agni, Druma, that is tree, Shailebhyo, that is in the areas of Parvata. So in this Vishama Pradesha, for the risk of falling with the fits into and can end up with a chaos. So that has to be avoided. Now coming to the important drugs used in Apasmara. So Brahmi, Mandukaparni, Vacha, Kushta, Shankapushpi and Kushmanda. Of course, Gugulu Palankasha is also one of the drugs very frequently mentioned in the context of Apasmara. So I was just browsing through the details of these drugs, and just to highlight Bakopa Mannari. So that is our Brahmi is known to see in case Matthew and his group consistently shown Bakopa Mannari reverses the decrease in GABA receptors. That means it antagonists the anti-GABA mechanisms of the this one seizure disorder. GABA, we know that it is an antagonistic system which backfires the abnormal firing neurons and reduces the seizure event. So that is about Brahmi. And coming to the Centella Asiatica neuroprotective benefits are attributed to the indirectly or directly modulating the ionic activities in the experimental research. So sodium, potassium, calcium. So we know magnesium. These are the things, and the ATP. So these are the things. Variation with these things can end up with seizures. Now coming to glycylisa glabra. So demonstrated the anticonvulsant activity and reduced the oxidative stress induced seizures. So then again coming to Acarus calamus, that is Vacha, beta-aceron seem to facilitate the electroshocks or the leptozole induced seizures. So calamus modulated the antioxidant enzymes, thereby preventing the ferric chloride induced epileptogenesis. That means it modulates the chloride channels and reduces the possibility of fits. Then coming to the Hengo is again, it is enzyme mediated antioxidant activity which reduces the seizures. Coming to the convolvulus, Shankapushpi and Clitoria. So they reduce the mean recovery time from the convulsions. But we know that there is a controversial research is also prevailing regarding Shankapushpi that it reduces the plasma concentration of the phenytoin when given as a co-administration with the anti-epileptic drugs. Further researches are needed to about this particular drugs. Now moving on to the case studies, I'll just put a few case studies which we have come across in our day-to-day clinics. So there was an 8.5-year-old male child who visited us in January 22 with a history of seizures, left-sided twitching of the face since 9 months. In the second episode he had after 3 months, which had 2 episodes, and 4 episodes in August 21st also he had. He was on allopathy medication, was thought to be having benign childhood epilepsy, and and he was on Oxetol and Ignicar for the treatment of this. With that also the twitching had continued. He had the consciousness preserved also. Then there was a EEG abnormality in both sleep and awake EEG. with a bilateral temporal lobe being affected. So the case was diagnosed as Pitta Kapha Pradhana Apasmara, and initially we gave him Deepanapachana, and initial Samanaushadha included Hinguvachadi Churna, Brahatpati Chintamani, Kumara Kalyana Rasa, and Siddharthaka Sana Churna, and ABL Taila Abhyanga. All of them, I'm not going to detail, they are all indicated some of the other way in the Apasmara Chikitsa. Then finally, the child was taken for Snehapana and Virechana. Snehapana was done with Brahmigrita, followed by Virechana. Then the Rasayana was given. After some gap, he was readmitted and was done Nasya with a Kshirabalavana for 7 days. And the Rasayana was included Smriti Sagara Rasa, Brahmigrita and Kumara Kalyana Rasa. After initiating Ayurveda treatment, in April 2023 only, he had one episode of eye blinking, which was acute managed with a Tantupashana. And the child is seizure free now, is still in our follow-up.
Hello, Dr. Reena, are you there? We can't hear you. Maybe some connection errors are there. Hopefully, she'll be joining soon. Dear delegates, uh, it's not due to the audibility issue. Dr. Reena had some problems with the network. Hopefully, she will be joining back soon. We'll wait for a few minutes. Thank you. Welcome back, Dr. Reena. I think you should unmute yourselves. Your mic is muted. Yeah, now it's clear. Audible.
If any few questions, sir, I think we can take up.
I hope you are completed with your talk.
Yes.
Oh, that's great. I didn't see the conclusion slide actually. Thank you, Dr. Reena, for such an elaborate presentation. That case discussion was also very nice. Getting the researchers in the field. A complete description of the Ayurvedic and the modern parallel went very nicely. And now the session is open for questions. You can either raise your hands, unmute yourselves, and ask the question directly to the speaker, or you can put your questions in the chat box.
In fact, suddenly at the last slide, I got lost with the connectivity, and I was in doubt whether the whole presentation went well or not. So, listening to Madam's comment that case reports were seen, I hope I have completed. There is a question in the chat box. How long we can use Shriti Sagara Rasa? As such, any rasa we need to use a little bit carefully. There is no such thing mentioned that only this much period we have to give. But as a general rule, 1 mandala is the period we use Rasaushadhas. Apart from that, we withdraw the medications, we give some of the personal medications and we continue. So the maximum period we have given Sruti Sagara Rasa for this child is around 1.5 months at a stretch. Dose of Snehapana in 6-month-old child. Can someone help me to read the questions, ma'am?
Sure. Dr. Lakshmi, can you help her to read the questions out?
How
Yes,
many
ma'am.
days? And, yeah. Coming to this question, I don't understand the reason for doing Snehapana in 6-month-old child. We know that the child is on breast milk, is already snigdha. No need to do Snehapana as such. And if you are thinking of Shodhananga Sneha, but in case if you want to give some Shamana Grutas, yes, we can give. And the dose could be as less as 0.5 to 1 ml, not more than that.
Ma'am, there is one more question. With the palatability of Panchagavya Grita, is there any issue with the palatability of Panchagavya Grita?
Too much issue is there. not about palatability. The very smell is obnoxious. People don't like to take the medicine at all. But if the disease is too much troubling them, they would be ready for any remedy. So in that conditions, they will be. We need to do a psychological counseling before that, and some modifications can be done. Like we make pravicharan out of this by adding some jaggery, milk, and these things, and that can be made and given.
Ma'am, next question is, which type of seizure can easily manage with Ayurveda without anti-epileptic drugs?
It's a typical question. See, any child coming with a EEG abnormality, and they have the seizure events which involve the generalized presentations. Please do not take any risk of treating such children without AED. Hopefully, you can go along with the AED as an add-on therapy. After a certain period of time, your neurologist itself take a decision to taper the medications and to withdraw the medications. I think that would be the better idea instead of putting the child's life into trouble. And those who are ready, who are not at all willing to take AED with the consent, we can definitely go ahead. And in case of focal seizures, definitely we can go ahead with only Ayurveda medications. And
Okay,
this is
ma'am.
with regards to my knowledge.
Okay, ma'am. Thank you, ma'am. Another question is how to assess which yoga to use based on the virya, whether Ushna or Shita in different epilepsy cases, whether the Ushna virya will trigger the seizure attacks. That's a question.
Ushnavirya will trigger the seizure attack. There could be possibility in Paithika Apasmaras. Exposure to any Ushna prakriyas can trigger. Definitely, in case of Paithika Apasmara, you have to go ahead with the Mrudu and Shitala medications. With the drug of choice itself is mentioned as Amalaki and Kudichi Siddhagruta for the treatment of this one. Again, Brahmigruta being its Saraguna and Tiktarasa. Of course, Medya at the same time it is Pitahara also can be utilized. And when you feel that some association of doshas are there or the dosha predominance is there, in my experience, I feel that Kalyanaka Gruta should be better. And most of the conditions which presents with Tivra Vata Kafaja type of presentations, then one can utilize Panchagavya or Mahat Panchagavya Grutas for the treatment, and Mahapashachika is also available, which can be taken in Apasmaras.
Thank you, ma'am. Another question is it possible to treat epilepsy in a patient who have been under medication for epilepsy since 16 years?
With the 16 years, whether the child is still getting the seizure attacks or is seizure free. The possibility is that, see, the 16 years long duration of treatment. Normally what happens, the neurologists take a call to taper down the medications following the effective control of the seizures on anti-epileptic drugs, and a seizure-free period for 2 to 3 years is the dictate that they think of either tapering or altering the medications which is given for seizures with the complete EEG monitoring and all. But that is no foolproof. There could be sometimes alteration in the medications can trigger back the seizures. In such conditions, of course, we can go ahead with the add-on therapy and look for the possibility of reduction in the severity.
Okay. Ma'am, next question is what would be the dose of Snehapana in 6-month-old child? How to decide?
I think I answered this question.
Okay, sorry, ma'am. Next question is in the case of Nasya with Kshira Bala, 101 drops are advised, what would be how the mode of action would be? Can you elaborate the mode of action?
So it was just with the idea of inducing snehana navananasya for the child with a epilepsy to soothe the abnormal firings in the brain, which leads to the abnormal cortical stimulations, and most probably Shirabala is Vatapitta Hara in nature.
Okay. Thank you, ma'am. Next question is.
Kindly share the practical use or practical experience of Manasa Mitravadaka.
Yes, Manasamitra Vataka, we keep regularly using in the clinical practice. And most of the any abnormal psychological behavior we use. Again, Pitta Kapha Pradhana conditions presenting with a psychomotor presentations, Manasamitra Vataka would be ideal to be used. Seizure disorders, we have not used Manasamitra Vataka.
Next question is, how can we manage epilepsy when the child's age is below 6 months? What drugs can be adopted?
See, again, I told below 6 months, seizure attacks could be because of two reasons. If it is a acute seizure, it could be because of any of the metabolic reason. So you please correct the metabolic the phenomenon that may be controlled. Or a 6 months old child presenting with a seizure, most probable diagnosis, it goes for the brain malformations. So they will be usually refractory epilepsies. So they would require a full course of anti-epileptic drugs and full course of investigations to rule out the pathology, especially in the brain. Most of the neuronal migration disorders secondary to parencephalic cyst or malformation of the frontal lobe or temporal lobe. So they can present with such kind of seizures, or sometimes even the torch infections can trigger seizures, especially the toxoplasmosis gondii, right? So they can present with the seizures, and they even have to be undergoing screening for the other manifestation, other systemic syndromic manifestations. So I think a full investigation and a pediatric neurology opinion is very essential before we think to treat it with only Ayurveda medications.
Thank you, ma'am. Next question is, how can we treat epilepsy during Vega Kalina Avastha?
Vega Kalina Avastha, for our shock, we have nowadays Midas spray come in the practice. They say that as soon as you feel that the child is going to have epilepsy, the Midas spray has to be done to the child, and that prevents the impending seizure attacks. Then what is the doubt in understanding that nasal administration of drugs like Pradhamananasya or even the Katabhyaditaila or Palankashaditaila definitely would have their action. And to share one experience, I think if Dr. Nagaratna is there from Andhra Pradesh Tirupati College, she is there. I think she can share her experience. They are doing one wonderful work on Vega Kalina Chikitsa of Apasmara by doing Nasya. If somebody from Tirupati College is there, I think they can add on to this.
Nano, don't do that.
I think from Tirupati College, no one is there. Can you please explain that, Dr. Reena?
They are doing one project, and they are using, I'm not very sure which churna they are using. They are using as a Nasya in the Vega Kalina itself. I think they have taken some grant also from central government, and they are planning to take it as some license for doing that Nasya. Not very sure about this. I just happened to come across this.
Okay, okay. That's a new knowledge.
Shall I go to the next question, ma'am?
Sure, sure.
Yes, please.
The next question is seizures due to electrolyte imbalance and altered sensorium. In such cases, without fluid management in acute phase, how can we manage through Ayurveda?
No, if it is a documented metabolic variation with electrolyte imbalance, the difficulty for us is to push these electrolytes into the general circulation. May not be possible through the oral administrations. Maybe with the initial help of the IV management, follow-up we can definitely advise the oral medications to maintain the ionic levels. So we have like Hinguvachadi Churna, Hingvashtaka Churna, then we have what's that? Lavanaskaskara Churna. So we have the utility of Kshara and Lavanas in various combinations. Ingwa, they maintain the metabolic variations has to be treated with the acute management protocol.
Any more
Shall I
questions?
move on to the next question?
Yes,
Hello.
please.
Yeah.
Yes,
Can Rasayana help if the patient is seizure free and without any medication? If yes, what Rasayana can be given?
Yes, definitely. At the end of the chapter in Svishruta Chikitsa, he says that though it is a Mahavyadi, the Rasayana has a scope to maintain this particular condition for the lifelong. So the various drugs we have discussed so far are not only the Roga Shamana but also Rasayana. Apart from this, one can utilize Brahma Rasayana, one can utilize Chavana Prasha itself, or one can utilize some gold preparations in the form of Kumara Kalyana Rasa or Brahatvata Chintamani, or even simple Brahmi Gruta itself for a long time, or simple home remedies, chewing of the leaves of Mandukaparni and Brahmi is classically also mentioned. Utilization of Kushmanda Swarasa with Yashti Prakshepana is also mentioned in Ashtanga Hridaya and Sushruta Samicha. So there are many other traditional medications mentioned, so which can be utilized as the rasayanas also.
Thank you, ma'am. Ma'am, one more query is there regarding this Vega Kalina Avastha. Does Nasya actually help in Vega Kalina Avastha? If we are giving Pradhamana Nasya, may Pradhamana Nasya trigger the Vega Kalina Avastha? That's a query.
We have seen the person who is unconscious after doing Pradhamana Nasya with either Vachachurna or the combination of Vacha Yashthyadi Churna we have practiced, and we have seen that the person suddenly shows the response to the sensory stimulus after doing this one. And even in Pakshagata also we have seen the Lashana Swarasa is being given, and also some of the Rasaushadhas are being used for the Nasya, and the person responds. But we don't have any documented evidences to say this much happens with this much administration of this. Probably this is one of the area for the research by Kamarvati practitioners.
Okay, ma'am. Ma'am, one more question is there. Which Grida would be very effective in the management of tonic seizures for 5-year-old child?
Tonic seizures for 5-year-old child.
Which
So
Grida would be optimal?
5 years old child, I would again go with my choice is always Brahmi Grita. Kalanaka Grita can be used, but my choice is always Brahmi Grita. Because we have, how much ever cases we have treated, Brahmi Grita has given the confidence for us. So Brahmi Grita would be the choice.
Thank you, ma'am. Is there any more queries?
There are also mention of Dashamula Gruta, Dvipanchamuladi Gruta with combinations of Medya Kalkas. They can also be utilized, but these things, see, the drug choice again, selection of the drug, most of the time goes upon their availability. So if we are using some classical preparation which is not available handily, it becomes difficult for us. So available grutas should be utilized.
Is there any more queries? If there are any queries, please do put in the chat box.
Madam, namaste, madam. Madam,
Namaste,
is
sir.
there a chance of drug interaction, like modern anti-epileptic drugs and Ayurveda?
Yes, sir, I was mentioning when I was telling about the recent updates, the Shankapushpi is known to reduce the serum concentrations of the phenytoin when given along with this one. But I think if you really want to give, maybe the co-administration may be avoided. Same time administration of the both the drugs. We can, if the child is on, we have the T half period also. So the maximum concentration period. So in between, we can advise to give this, and we normally give either Brahmivati or Kumara Kalyana Rasa, or even sometimes Shankapushpi syrup also we have given. We have just seen that we don't give it together. Then we have not come across any such events in the clinical practice. And regarding the other drugs, there is no documented drug interaction with the other drugs, like Vacha or Brahmi. Brahmi is usually potentiates the action, and especially in Vacha, especially in case of this one absence seizures, ethoxyxamide is the drug which is used, which actually potentiates the action of the anti-epileptic drugs.
Okay, thank you, madam.
Ma'am, am I audible, ma'am?
Yes, please.
One more question is there, ma'am. What will be the role of external therapies in epilepsy along with precautions while performing the procedures? What all precautions should be taken while performing the procedures?
Yes, of course, external therapies are utilized. Like, you can do Rukshana, Stehana, Swedana. So, Basti also we have done. So, when we do all this, even invariably the external therapies are also done. So, only thing is when you are doing Swedana, be careful when you give Tikshna Swedas. There could be possibility that these children can have a seizure trigger when they are given this Tikshna Swedas, like Shastika Shalipinda Sweda or Bashpa Sweda especially, and sometimes even the tub bath. So Avagaha Sweda when they are given, if you are planning to give full body avagaha sveda, you have to be careful. We had two instances in our hospital that the child was not on anti-epileptic drug, but he had a one seizure history previously. The child was not on any AED also. We were just going ahead with the treatment. He was fine. Quite a long time he was with our follow-up. But one fine day when we started with the avagaha sweda for the child, for some other complaint, the child had the trigger of seizures. But then we had to withdraw that. So following which it has become routine for us also to have a look before advising Krishna Vedas for these children. And while doing this, see that you put a proper thalam and a proper supervision is required. Don't allow the child to sit alone and go the this one. The caretaker moves here and there. So these are the conditions where the difficulties can arise. So be cautious with administration of this.
Thank you, ma'am. Ma'am, one more question is there. What measures should be taken once an episode of seizure are setting? What measures should be taken once an episode of seizure are setting?
So any seizure, especially in children, the current guidelines as per IAP neurology goes that even a single attack of seizure needs to be evaluated thoroughly. One has to undergo EEG as well as, if required, neuroimaging has to be done to rule out, because we don't know the onset, whether it's because of any acquired causes, or it could be any because of the inherent or structural causes, or just because of some the infective or the triggering mechanisms, which has a thorough investigation has to be done for any of the cases, even though they present with a single attack of seizure.
Thank you, ma'am. And ma'am, one more question. Can we use Vidya Karma in seizure cases?
Classically, it is mentioned that with the karma we have to use, but I personally have not done any Rakta Mokshana for these kids with the Apasmara. But I have seen in our college, our colleagues are doing with the karma in the sense Siraveda. They what they use? They use the needle or the scalp vein, and they let out some amount of blood from that vein. We have seen that, but not practically utilized in the pediatric cases in our purview.
Okay. Is there any queries? If you are having any queries, participants, please do put it in the chat box.
I think we have come to an end of the Q&A session, Doctor.
Okay, ma'am. So shall we conclude today's session, ma'am? Oh, one more question is there. One more question has come. Just a minute. At what period we should continue the medicines after the last attack of seizure?
Sorry, I didn't understand the question. At what period we should continue?
I think the questioner has thought that how much period after the attack of seizure, at what period should we start the medicines? Maybe that will be the question, I think.
It's a tricky question. Again, no consensus are there on how long the medication, seizure medications has to be continued. Whether it is Ayurveda or allopathy, the consensus are not drawn completely, because seizures are one such disorders. They can be under control with medication or without medication also. But any point of time, 40 to 30 to 40% of them can trigger with the seizures any point of time. So the clinically, what we have seen that we have given medications for around 2 years for children, and then we have withdrawn. With minor procedure, something like we might ask them to continue the Pratimarshanasya, or once a week we may ask them to take any of the Kushmanda Swarasa with HT or something like that, or even Kumara Kalyana Rasa itself twice in a week or something. We have asked and we have withdrawn the actual the seizure medications, but there are no consensus that after 2 months you please stop seizure medications. So there is no such consensus for seizure disorder.
Thank you, ma'am. Hope the Q&A session is over. So thank you, Reena ma'am, for such a wonderful session, taking us through various types of epilepsy and also detailing the Ayurvedic perspective. Thank you, ma'am. Thanks a lot for making this session wonderful. And now, I hope all the participants will treasure the knowledge on epilepsy by completing this 1 week CME. And so I would conclude and tell everyone that thank you all for this participation and making it successful. So let's gather tomorrow evening with the next topic, Bala Apasmara, from the basics to clinics by Dr. Sohini S., Associate Professor from the Department of Kaumara Vritya, Government Ayurveda College, Trivandrum. So see you all tomorrow. Thank you all. Thank you. Good night.
Thank you. Thank you, everyone.
Good night. Take care.
Good night,
Meet you all
ma'am. Thank you.
tomorrow at 6 p.m.
Good night. Thank you, Reena.
Definitely. Yes, ma'am. Thank you.